Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
I have been a direct primary care physician in private practice for 3 years now. And direct primary care to me now is really the freedom to challenge yourself and allow yourself to not only practice medicine with freedom, but also allow your creative self to innovate in how you deliver medicine and problem solve life all the time for your patients. There isn't, like, when I jumped into it, I thought there was going to be this one template that I'm going to have to follow, but it's really like, that's not what DPC is. It's just like, you jump in and it's this live project that you're always on and you're always improving. And what I do now looks so different from what I thought I was going to be doing. And it's great. I'm Dr. Nas Mohammed. I'm based in San Francisco. I own Ulster Medical, a direct primary care practice, and this is my DPC story, part 2.
Dr. Nas Mohammed is a DPC physician and a Qatari LGBT rights activist, and he is here today to share an update on his DPC story. He opened Ulster Medical, his DPC practice, in 2020, and in 2022, he became the very first Qatari to publicly come out as an LGBT person on BBC News. Since then, he has continued to fight for LGBT rights, especially when it comes to their healthcare. Welcome to the podcast, Dr. Mohammed.
Thank you. I'm so excited. Dr. Nas is my brand now since we last talked.
I love it. Love it, Dr. Nas. So I will tell, the audience, just because this is so special on many levels. And Dr. Nas and I were talking about the significance of the date that we're recording this. But I will say that I had the amazing pleasure of having a rainy day dinner with Dr. Nas in San Francisco just a couple of months ago. And what I loved about it, Nas, is that when we met, it's like it was just an extension of our friendship that we've had over, Zoom and chat and whatnot. And I really encourage people, as they're listening to these podcasts, to reach out to people to see if you can meet them in person, because it was just incredible. Like I already felt that, we did know each other, but like knowing each other in person was a totally new thing. And what a treat it was. So again, thank you so much for being on the podcast and sharing your story, part 2. And, as a drop there, that this is a significant time in your life. Can you tell us what is significant about Pride Month 2023 and you coming onto the podcast on the day that we're recording?
Yes, absolutely. First of all, it was amazing to meet you in person. And I'm so proud of everything you've been doing, including this podcast. It's just, you do such an amazing job. And I got to interview with hundreds of people now since we last connected. And you are amazing. Honestly, you have such good caliber. You do this really well. You have a talent. And this week is very special because a year ago from this week, I came out publicly on BBC World as an LGBT person from Qatar, becoming the first and still the only publicly out LGBT person.
It's just incredible. And again, think about you as an individual wearing that or bearing that flag, but also the fact that you are a physician. And I think that that is really, really what is so unique about your practice in particular, is that you are such an advocate for those who are marginalized, specifically in the LGBTQIA plus community, but also when people are looking to you and your practice, they're looking at, how do I practice inclusive medicine under the direct primary care flag? how do I, especially for those who are LGBTQIA plus, there are, I think, moments of empowerment when, other physicians who are LGBTQIA plus are seeing other physicians practice, celebrating their pride, but also taking that shared trauma of marginalization because of their, identity. And that's so silly when I say that, because we all have identity, and yet somehow we see marginalization because people have certain identities, right? Like, that's what I really love about your advocacy is it allows other people to hear how empowered you are as a person, no matter what your identity is, but specifically physicians who are LGBTQIA plus, they are able to practice more confidently, bringing their own identity to their practices, because if you've seen one DPC, you've seen one DPC. So I hope that really opens our month of pride on My DPC Story as we celebrate identity, inclusion, and not marginalizing our patients, no matter if they have insurance or not, if they're documented or not, if they're of a particular identity or not. They're humans, just like you and I. So with that, I want to go back into this past year that you have been, on this platform of celebrating who you are and celebrating freedom, for, to summarize the many talks that you have given. But it's so interesting because when you came onto the podcast the first time, you were talking about how you were Qatar's first sports medicine doctor. And then all of a sudden, you're there because they're prepping for the World Cup, and now the World Cup has happened. So can you take us back to, pre-World Cup, during the World Cup, and post-World Cup? What are some things that you saw that, you really either were expecting or not expecting to see now that the World Cup actually happened?
Yeah, I'll try to be as concise as possible. And if anybody wants to learn more about any part of what I'm talking about, you can just Google Dr. Nas from Qatar, and there are a lot of articles online on different aspects. But what happened is, so after I left Qatar and finished my medical training here and decided to stay and file for asylum because I didn't feel safe going back to Qatar, I honestly been just living my own life here, right? And I have been focused on medicine. I got into DPC, and at the same time, I was doing a little bit of LGBT advocacy work with international organizations. So I was still involved with the LGBT community in the Middle East in some capacity. So I still had very good sense of the ways and the challenges, I should say, the challenges that the LGBT community in the Middle East are facing. And then as the World Cup was about to happen in Qatar, what was really striking to me was just the PR and marketing around it. I was sitting in a coffee shop one day and I just saw an ad on TV, and I was like, this is not where I grew up. Like, literally. I spent the first 24 years of my life there. And I was like, I know you want to do a good job. I know you're putting your best foot forward to host a global event. But then it was really used to cover up certain stories and certain aspects. And I'm sure we heard many different issues around human rights violations that happen. But from my lived experience, my story and my personal struggle was being erased by this World Cup. And then the officials that were going on and speaking publicly were basically denying, first of all, like at their first stage of denial, they were denying that there is an LGBT community in Qatar, period, which is insane. But then they moved from there to then denying that they abuse the LGBT community. And I was in touch with a handful of them that were living in Qatar. And we were just kind of waiting. We were like, okay, one of us must speak up, like at some point. And then I realized that it was going to be me, probably, because there was nobody speaking and correcting the narrative, the false narrative. There were just so many false misconceptions and narratives. And I really believe at their core, they all come from the belief that LGBT rights are not human rights. Really, in their core, like that's the core of the argument. People don't believe that this is a variation of humanity. That's a way that a group of the population is different. And then that belief system is presented in arguments in so many different gaslighty situations. They will talk to you about attacking religion. They'll talk to you about attacking a culture. They'll talk to you about attacking traditions. They'll talk about how you're hijacking platforms. And when you really dig a little bit deeper, you realize that the core issue is them not believing that you're just a different person, and they believe that you're just out there to corrupt society or whatever bizarre like belief system that they have or stereotypes about what an LGBT person is. And, I kind of DPC'd the whole thing, I should say, because when I came out publicly, I came out with an intention to do something about it. I didn't just come out for the sake of coming out. I was like, I have few months. There is this massive global platform, and I have few months to go ahead and set the narrative right. So I went on BBC News and said, LGBT Qataris do exist. I am one of them. I am also a physician. And then I held all my identities firmly. I'm an immigrant, I'm Arab, I'm of Muslim background, and I am an LGBT person. And then everybody was confused because all these different groups had, their own views, and they didn't want to necessarily include the other one. So me coming in and just owning all these different identities simultaneously did change the conversation and how we're holding the conversation when the World Cup was happening last year. And over the following few weeks, like within 3 months, I was covered in most languages in most continents. Like it was all over the news. We're like, there is somebody gay from that region, which is crazy that it's breaking news, but it was breaking news because there is absolute lack of visibility of my community, and people just don't know that we've been suffering in silence. And then from the press, we were able to connect, and by we, I mean the local LGBT community, because what my BBC News interview was in both English and Arabic, and the Arabic segment aired in Qatar. So I got hundreds from Qatar reach out to me, share their stories, share their experience. And then we got three documentaries out since then. And I just filmed for the fourth one. And in those documentaries, we were able to provide substantial evidence of the methods of persecution of the LGBT community, but we were also able to have members of the LGBT community in the region interview anonymously with investigative journalists so their voice can be heard. And then a very big milestone that happened was a country conditions report with the Human Rights Watch. And that's really the first country conditions report on LGBT people in Qatar with some sort of evidence attached to it that has come out. It was done by us. It wasn't done by a big global research organization. It was just us, grassroots movement. We got together, we identified the elements of what it takes to publish an evidence-based country conditions report, and we did it with the Human Rights Watch. And that, to me, is what it means to be a DPC doc. You just, you're like this underdog. You come in and you execute and you deliver. And you don't have to be fancy to deliver something effective. And that report got me connected to then the second tier. So from there, I got to meet the presidents of football teams that were in Qatar. I got to meet a lot of government officials, including the US State Department, and got to speak to different governments in Europe. And the conversation became more serious. And then I decided to formalize it and open an NGO. I opened the first LGBT charity in the world that is focused on LGBT issues in the Gulf region. And it's based here in San Francisco, but it's connected to the local community there. And I'm happy to say that within a year of me coming out, I was already able to give a scholarship for an LGBT person from my country to resettle safely in England and start a new life. So that's a quick summary of what happened, but there was just so much that happened within that 1 year.
So much. And again, Dr. Nas we're airing this at the beginning of Pride, but the entire month of June, Dr. Nas is going to be one of the grand marshals of SF Pride. And he has a gamut of engagements where he will continue to speak. And, Nas, I really just love that how you talked about even in your opening statement, like that you have been able to be a physician who is able to do things like innovate. And I totally get how you brought your skills as an autonomous physician, entrepreneur who has the medical training and who understands socially, not only from your experience, but also from the medical side of things, what it means to be, the opposite of what you had on your website, be seen, be heard, be you. And so, when it comes to your journey, I am so, so, so grateful, not only for your advocacy, but again, for just the people who you've empowered with your advocacy. And I just love, I totally empathize and relate to when you said, you came out with a purpose. It's like when I think about when I started this podcast was started with a purpose because there are so many physicians like yourself and myself who have been the brunt of physicians are actually just people to process the magic codes so that we can get our money, fill in X corporation name, and there you have our healthcare system. And so, when it comes to you bringing all of your skills and your genius, when it comes to networking, connecting people, sharing your story, advocacy, it's so beautiful to see. And it's so appropriate that you are now celebrated as one of the grand marshals of this year's SF Pride.
Yeah, thank you so much for saying that. I totally agree with everything that you've said. And I really feel like that's what DPC is too, like to be seen, heard, and be you, because we're just such a diverse population, all of us. And we have such diverse skill sets. The patients we care for are different and diverse, and they would want to see themselves in us as their healers. So it is only natural to have the first line of physicians caring for this super diverse population to also be diverse themselves and be able to adapt to our own small bubbles where we practice.
And that truly is, why independent practices are growing like crazy all over this country in every single state. Because, we've had people on the podcast like Dr. Andy Burkowski, who's a quaternary specialist who's doing direct primary care, to, the people who are pediatricians, family practice doctors like yourself and myself, and, primary care doctors, because everybody in this country, everybody in the world, but specifically when it comes to direct primary care as a business model, everybody deserves this type of care, whether you are, again, fill in the blank, insured, uninsured, documented, undocumented, it does not matter. So when it comes to the idea that you are bringing yourself to Ulster Medical, how has Ulster Medical changed as a result of, everything that's gone on in your life over the past or since you were on the podcast last?
Yeah, so like the practice just like keeps changing because, I learn and then I integrate what I'm learning. And then I just always evaluate what my patients are responding to and innovate again. And the thing about my practice is that I run a micro practice, even like in the DPC world. Like, I don't want people to like hear me here thinking that I have like, I don't know, 1,000 patients that I'm taking care of. I don't. I have less than 200 patients. And my pricing is different than traditional DPC practice. It is priced to meet the like economic bubble that I'm in San Francisco, and is also equipped to compete with local systems. I shouldn't say compete, but deliver what they don't deliver. So it's really like I'm positioning myself very differently, and I like my competition is tough locally. And then the ones that seek my care know that they are not going to get it somewhere else in San Francisco, honestly. So, and I can say that now. And there were just a lot of like really big moments, I think, for Ulster Medical. I want to, like, the Injectable prop was a huge moment for me. So I think, when was it? It was the end of 2021. The FDA approved another method for preventing HIV, and it's long-acting cabotegravir, CAB, or also called Apretude. And I was lucky enough to be able to meet the researcher that was doing the clinical trial early on. And then when it got the FDA approval, I was like, you know what? There are people that are not candidates for TAF or TDF, that's Truvada and Descovy. And I would love to be able to offer this service here in San Francisco. So I got ready and did it and gave the first injection in Northern California in my private practice. It was before the San Francisco AIDS Foundation or UCSF or Stanford or any of them. And that was in the news, and that got me some patients. And now I'm also like involved with the pharmaceutical company, teaching other physicians how to do it. And gosh, I would never have done this if I was an employed physician. I wouldn't have had the like bandwidth to just sit down and think about all the little steps. And that's what I love really the most about like DPC in general, that it's like it's alive. It's not just one thing that you just do on repeat till the end of time. It's a living thing and it grows with you. It's like your baby, and it's awesome. And I love the like passion, just seeing like how different physicians are problem solving and really having their patient be like the person they're problem solving for, to see how they can help them win their own story. And that's just awesome to see.
That's a DPC physician right there, people. Oh my God. Like I'm just over here, like I'm on mute because I don't want to interrupt, what you just shared, but I'm like, yes, like if I had one of those, what are the things they bring to soccer games, the like big horns, like that's what I'm like feeling inside of me right now, that because I love it. And this is the stuff that people, when they hear about autonomy, that's one thing, but when they hear about how autonomy manifests in all of us as independent direct primary care physicians, it's incredible. It's like, this is your journey, and when I say that, that is your journey to every single person listening. But this is your life. We only have one. Like, let's live it big, But when it comes to living it big, yeah, you have under 200 patients by choice. It's not you have under 200 patients and you're not successful. You have under 200 patients because, like you said, like that's what allows you to be Dr. Nas and to do all of the things, including taking care of patients. And I think that, this is the type of stuff that, and I encourage anybody who, whose kids are in medical school or who knows, the neighbor's daughter is in medical school or whatever it is in residency, tell them about, hey, did you know that there's a way that these doctors are practicing and they're like doing all the things, taking care of patients, and they're doing art, advocacy, whatever the heck it is. But when we talk about, the attraction of direct primary care practices to patients, I also want to just go back to the fact that, you were the first doctor, like you said, in Northern California to give the injectable. I just love that when Apertude came out, that like, because you and I had talked about this, you shared that with me over text when it happened, but it was like, that is so flippin' awesome that a pharmaceutical company that is bringing to market, a type of medicine where other people cannot get treatment with traditional medicines, like you mentioned, like Descovy, Truvada, but they would approach you of all people versus, like the UCSF, the San Francisco AIDS Foundation. So when you were talking with this researcher, whatever you can share, I would appreciate, like, how do you think about how, the company that owns and runs Apertude was attracted to you as a physician versus, one of those bigger companies, and decided to have you have that amazing honor of being the first person in Northern California to do the injectable for patients?
So I'm the one that approached the researcher. So the researcher is not with the pharmaceutical company. He's a faculty at UCSF and he works with the Department of Public Health. And I knew of him actually through the community, and I just reached out and said, hey, I heard about like long-acting CAP. Can I take you out for a drink? Literally. And I took him out for a drink and I was like, so this is what I read and I love your work and I would love to do this. So I didn't really wait for permission to do it. So I just was like, I'm going to be the one to do it. And learned the steps, learned from, because he had taken care like of patients for about 4 years at that time in the clinical trial on it. So he had the experience, but then I was going to be the first one in the community to do it. But then doing it in the community is now going to be a different animal, right? Because insurance, because it has to be authorized. So I was going to be the first one to figure out how to like convince insurance companies to cover it, which was really part of the challenge, but also it comes from it's an injectable that comes from a specialty pharmacy. And you need to have it delivered. And so there's like the logistics of getting the medication and delivering it. The fact that I was able to deliver that and give it within 2 months of FDA approval And in other words, actually, so like the pharmaceutical company didn't even have it manufactured and ready to go out in January. It was FDA approved in December. It was not ready in January. It got ready and was put on the market in mid-February. And then within 2 weeks of it being on the market, I gave the first shot. And when they saw somebody able to give it in the community within 2 weeks, they reached out to me because it was like quick. And they were like, how did you do this? Basically, because on their end, they were trying to navigate how to help physicians get it and navigate operational workflow, like blood work orders, prior authorizations, the copay coupon, the shipment from specialty pharmacy, like all of that like was still being navigated. But if you can and have time to figure it out, it's actually not that hard.
And the experience. I mean, it's like you're training every day as a direct primary care doctor because you like face these challenges that you didn't even think, were there because you had the corporations, for those of us who have been through fee for service, this is, mostly who I'm speaking to, but like you have the other people who just like, quote unquote, handle it. And then when you're a DPC and you're like, oh yeah, like to do these things, these are the steps that I've taken with other workflows or other challenges that I've faced. And so like, oh, present me with problem. Great. I can give you said solution. So, I think that that's so awesome. And, again, it's just like you're developing your practice around your patients and you're developing your advocacy as well as your practice around your community, which I flip and love. And that's what all of us, I feel, are doing in our DPC practices. But the fact that you were able to bring this, treatment to your community as fast as you could, it's just like, that's so empowering. And whether that be, like skin cancer screening in people's communities or, whatever it is, like your equivalent to aptitude in Dr. Naz's case, it's just incredible that like you can actually just do whatever you need to do to treat your patients the way they needed to be treated. So, it's just so empowering. When we talk about your practice changing, one of the things I want to ask about is how you've proceeded to, get to your happy number. And how did you decide, like, this is my happy number, patients, and not, go over that, not go under that? How did you continue to look at your practice and evaluate it so that you could balance your patients as well as your non-patient part of your life?
I'll answer this question to you very transparently. Like when I was doing this, I balanced a lot of things. One of them was to sit down and really be honest with myself about what makes me happy as a person. I was like, what kind of days do I want to have? And how much money do I need to afford this life that I want? And then decide like how much money I want to make. That was like and then like picture the life I want. That was like what was going on through my head. It's like, this is the life that I want, and this is the money number attached to it, and this is what I'm going to have to make per year to afford that life. And then once I have that number, I don't have to make all of it from medicine. And I was like, how much of it do I want to make from seeing patients? Because, sitting down, for example, with the researcher he sees patients, and like his happy combination, for example, is having a panel of 60 patients that are super sick with advanced HIV and doing inpatient work a couple of days a week or a month or whatever. I don't know how often he does it. And then doing clinical research and then advising some nonprofits on HIV medicine. And this is his combination, so he's not seeing patients every day. And I was like, this sounds amazing because you use different parts of your brain and you use different things you lean into different things you're passionate about. So for me, I really am very passionate about human rights and advocating for the safety of my community. And I really love doing my nonprofit work. And right now, I wouldn't say that I have decided like fully what the cut is going to be. I thought I was going to cap at the number of patients that I have now, and not take more and then just grow my nonprofit. But right now, I think I will go and grow my practice a little bit more just to get to practice a little bit more medicine. And then I'm still just exploring, I should say, like the nonprofit side, how much of it I want to be doing. I had people straight up tell me to leave medicine and just go full time running this. Yesterday was an insane day for me. That is not a regular day by any means, but I started my day at 3 a.m. I woke up, was on a conference call with London. I was talking to corporations that wanted to open in the Gulf region, and they wanted to hear about the safety of LGBT employees and also using their platform to help LGBT rights in their region. And I was one of the people they invited to that panel in London to speak about local issues and how to navigate them. And that was really an awesome experience. And then from that call, I was on a call with Berlin to talk about advancing LGBT rights in Europe and asylum policy, and also like a follow-up segment on the World Cup. And then after that, I got my breakfast and got ready and went to the office and had a full day of patient care. I saw 8 patients, which is a lot for me in one day. It's not a typical day, but I saw 8 patients and then did some intro calls with possible new patients. And, that was just like a full day. And then one of my patients got really sick. So I had to be like on call for him and help him. So I ended up working from 3 a.m. until 8 in the evening, which was a really long day, but I loved every single hour of it. It was like everything I wanted to be doing. And do I have days like this every day? No, this is just a very unusual day. And it's just like something that I really want to say, like, it's really not about the volume of work that we do. It's about the quality of the work that we do. And it's just like, if I had worked just 1/3 of that amount in a job I didn't like, I would be burnt out. Like, I don't think I can do it.
I quote you all the time when it comes to what you said in your first podcast episode, where you said, I've never worked harder in my life, but the work that I'm doing is so much more meaningful. And I'm not quoting you exactly there, but that it is not hard work like, you're a hard laborer who is like struggling with getting through each day. It's your baby is, it needs attention, and how your kids grow, our clinics grow. And so, I think that was really powerful to hear you say that. And I know that other people have taken those words to heart, because it is so true. Like, we were not trained in medical school to think as independently, I feel, as we are now as DPC doctors. So it's just wonderful to hear, you work through like how you are approaching patient care as well as non-patient care. When you were mentioning how you had a couple of potential patients that you were talking with yesterday, I want to go to your initial meet and greet, because when I think of meet and greets in my practice in the very beginning, I would set myself 30 minutes. Like, it would be a really big struggle to achieve that, that conversation in that time. And then now it's like 15 minutes. This is a free visit period. And I'm much more confident in my ability to get questions asked from the potential patients, as well as provide them answers. And like right now in this season, my husband is joining my practice. And so
I didn't know that.
he well, because he got replaced by non-physician model at his old clinic. That's a whole nother dinner conversation that we will have shortly. But when it comes to, learning how to do the meet and greet, he's learning, by physically being there on the calls and watching. But because you've been able to learn from yourself and change your practice, how have your meet and greets looked different or changed now compared to when you opened?
I feel like it's 100% a lot more concise, a lot more confident. I feel very secure about my product and what I do. And I also feel very okay saying this is not a good fit. And the way I structured them now in San Francisco is that I call them a free primary care consult. And in that free primary care consult, I present my practice as a solution for the primary care for the patient that's seeking care. But I also tell them about other models around with, like, I'm trying my best to remain neutral and tell them the pros and cons of each model and say, this is what I do. This is what One Medical does. This is what Forward does. This is what this person does. This is what you're going to get from in each model. Pick what's best for you. And they know all of these options and choose something else. That's okay. Because I feel like the ones that know all of this and pick me end up staying. And it ends up working out really well. And it makes me just even more confident when I go back out and tell the next person about what I'm doing, because now I have been delivering really good care in my model, and I've been taking care of patients, and I've been hearing feedback and changing the practice in a way that meets the expectations of the people that are seeking my care. So yeah, so I would say I present in my sales calls, if you wish, with authenticity and with confidence and with a message that's really concise.
I love that. And especially for those listeners who are, thinking about planning DPC or have just opened and are in that, place of it's new. I'm not really sure how to, do the elevator pitch or the meet and greet in a concise manner. Just taking from your story and my story, I love that, we've both become, more like solid in our shoes when it comes to this is what I'm bringing to my practice. And if it's in alignment, like you and I are both decision makers in that journey and not just, oh, a patient signed up and now they're on my schedule and I don't actually know who this person is, but I had an open panel and my corporation told me that I had to take them, so it's really great because you're right. When it comes to the people who invest in us as physicians, and yes, financially, because this is a business model, but also that they invest in us in that all of the care that they could have sought, they're choosing you as a physician. That is so empowering. And I encourage people to remind themselves of that if they're ever having days where it's like, oh, we just heard Dr. Jennifer Allen's story where a patient paid for her to go to medical school because that's how much she believed in what Dr. Allen was doing. Like that does not happen in an everyday fee-for-service clinic where your patients are, that invested in you as a physician, because like we see, I talked with somebody who was, she's a Kaiser doctor who worked for 15 years. She had gotten her benefits. She tried to, go back as like a mentor doctor, to do locums type work, I guess is how it was described to me. And it was like, no. And there's, the way she described it was that even if you left a model, there's 6 to 7 people who are like waiting to take your spot. So you don't feel that pride for our physicians. We are so proud because don't think of us as the company, think of us as the individual physicians who are actually giving you the everyday care. But you do see that in DPC. So I think that's incredible. When you talk about balancing everything, how your practice has grown and changed and how you've, continued to do advocacy, how do you pick and choose? Like we talk about patients picking and choosing. How do you pick and choose what to say yes and no to when it comes to anything that you are approached with in your life?
I'm still working on that. I don't think I do a good job. I think I do find myself saying yes to a lot of things still, and then end up just really overwhelmed at moments. But what I'm working on right now is trying to stay truth to that same vision that I told you about and be like, okay, what's my objective? What do I want? How much of it do I want to really reach the goals that I set? So defining these goals, I think, is really key in deciding what to take on and how much of it to take on. And that happened, like, for example, with the activism thing, it happened with like a lot of journalists like wanting to speak on and a lot of news outlets and things like that. And I said yes to a lot of them at the beginning, but then after like 200 of them, I was like, I need to like dial it down now and then like pick which ones I need to talk to. And then that's what I learned PR people do. So like it was like, there are these things that you just face and then you realize why there's just professionals that do certain things full time. And so I got, and the same thing with my practice, like as I take things on, you can easily hire a staff member and then keep adding and then hire another one and keep adding. And like, you can just keep doing that. So you need to just like sit down and see how busy you want to be. What does your ideal day look like, right? And I'm still working on that. I need to sit down and like really try to revisit my vision and kind of see like what direction I want to keep pushing.
I love it. And, like I think about how other physicians have shared about how do they maintain culture in their practices. And this is, another way to address culture because you're bringing yourself to the table. And if if you're stressed out or, irritable, whatever, it changes everything. I feel like how you handle unexpected situations or how you present yourself with patients, et cetera. So I think that that's awesome that, it's that you're being transparent, but also you're constantly working at it. Like you said, that you've never worked harder in your life, but this is different than, work as people normally think about it. But I will also give you a ton of credit because when I was like, hey, can we do a reunion episode, especially to celebrate your being honored as Grand Marshal at this year's SF Pride, your text back was, yes, I will have my assistant reach out with scheduling. And I was like, boom. To me, that when I get that from people, I think that as family doctors, especially, we're not used to seeing a family doctor not do it all, right? But at the same time, when I see that now, it makes me so happy because it says to me that Dr. Nas is functioning at the highest level of his ability and training, and scheduling does not have to happen by Dr. Nas. And so I was glad to, communicate with your virtual assistant and get myself on your schedule because that to me is a sign of ownership of your life. And so when you think about, there's, some questions about what can my virtual assistant do? It's one of them can be handling scheduling because that does not require medical education specifically to do. You can do it, but do you have to, right?
It was the scheduling part itself was just such a huge time suck. The patient, the activism things, lunches, dinners, there's just so many of them. And now it's just there's one person that's just taking care of that among other things that she's doing. But yes, learning to outsource is where I'm at now, outsourcing some of my tasks.
I love it. And again, it's it's so different from the world of, I think it was Dr. Verkowski who also said, oh, you need one more thing done for compliance or to get the magic codes, just have the physicians do it. Just hand them more work. And it's no, we're not going to do that anymore. No, we're just not. So I love that. When it comes to your presence, when, I will highlight how you shared with me such a powerful post. This was, I believe, New Year's, and you were saying, Happy New Year's on your social media. And you were showing me all of the engagement from Italy, from, the Middle East, from Asia, from all over the world. People were saying thank you and Happy New Year to you back because they were, being seen and being heard and celebrating everything that you've done. When it comes to social media presence and when it comes to the power of your platform, can you share with the audience any lessons you've learned about social media that can help specifically DPC practices grow their own presence?
So that's a tough question to answer because I learned a lot of things about social media, and it's literally another area where now I understand why there is a whole type of expertise that goes into it, right? There are people that do this full time, and my platform, when you look at it, I have, I don't know, not many followers, maybe 17,000, but my 17,000 people that follow me are 17,000 real people. And that's very different from bots or whatever that people do to give an illusion of being followed by a lot of people. And then the 17,000 people that I have are very engaged. So if I post something, it can be amplified very quickly. And that happened through that entire campaign last year. But what happened too is that now I became a public figure, basically. So I had to take my own personal social media accounts down, and there was just a frenzy last year of trying to find information about me by journalists. So everything that's online about me is just so public, and that's going to be that's a different journey, and I'm okay doing this because of the work that I'm doing. And as people know, as I'm talking to DPC docs on this podcast wanting to open their own business, you really don't have to have this level of visibility for you personally and this level of exposure, but you can really have really high impact in your target populations without massive number of followers. Really, I think for a DPC doc in a small community to engage people successfully with social media, if you had like a seed of like 1 to 200 people that are strategically selected, that are engaged, then you have a really good social media game. And you can do this by really trying to find them in spaces where you think you all would overlap. For example, like for my patient population, for example, I have an event next month where I'm going to be talking about advancements in HIV prevention in San Francisco. And it's going to be at a local venue, and it's going to have a lot of the target patients really that I want. So sharing my business social media handles in that context can get me like that seed number of followers. And there's so many DPC docs that I heard talking about social media engagement and tips and tricks that they do, and they're all great. I think it's just like what I do with the activism thing is a little bit different because it's a global platform and has just like a different mission.
And I think that it's important to, keep in mind your story, because if somebody is, continually highlighted, like I will mention the direct care physicians of Pittsburgh, how they're highlighted by magazines and radio shows, et cetera, et cetera. Be prepared for what happens if your practice goes, beyond the core people who are engaging and following. But what happens if you are, asked by a reporter to talk about your practice? What is your presence on social media? Adding things to social media purposefully so that it's already out there when it comes to, highlighting work that you've done in your community, whether that be with your practice or as a volunteer or as a physician. Those are things to strategically think about. And then another thing is that if you do something like, you incorporate a new hashtag or you work with a partner, there are ways for free to look at your Instagram analytics, Facebook analytics, for example, where you can say like, has this, whatever I did, made an impact? And did that lead to people joining my practice? Like, especially in the early days when people are growing their practice, there's more time. I definitely will say that typically, but that's a way to also, figure out how your social media can be more on point going forward. So
absolutely. And you can totally like also like speaking of this topic, like you can like you will learn this just as you do it. Like you just start with all of these things that we're talking about. Just start, evaluate yourself and learn, because you will learn like what type of posts and messages your audience really cares about and what kind of things they are more likely to use, save, share, and naturally give you more exposure because of the quality of the content that you're sharing.
Love it. One fact about you that is, I don't know if many people know, but you are licensed in more than one state. And so when you have decided to, we talked about how you figure out how to take things on or not. When it comes to taking on other licenses, specifically like California and New York, for example, how did you decide to take on New York as a medical license, and how has it benefited you as a doctor at your practice?
So I made the decision during the pandemic, and I had a cohort of my patients move to New York City, and a couple of them wanted to retain me as their physician, and I was able to still care for them via telemedicine at some point, and then more and more left, and then when I reached a certain number where my membership fees from them would cover the overhead and give me profit, is when I made the decision to go ahead and get licensed in that area. And I haven't gone out of my way to market and get more patients over there. But in New York City and San Francisco, just for my patient population, seems to be the two spots that people are going back and forth from. So it made sense for me to go ahead and get licensed. And now I may pick Massachusetts up, but I'm still waiting to hit that threshold.
I love it. And when you have, seen people in San Francisco as well as in New York, how have you paired your patients with services that will support their care? Like we talked about aptitude, but when it comes to like social services, when it comes to mental health services, how have you curated your list of recommendations for your patients?
So this is a good question. Some of them had their own specialists that they reached out to and they just introduced me to. So I then got to meet those couple of specialists that way. I did my training on the East Coast, so I do know some people in that area as well. But then if something random happens and I'm looking for certain expertise, some of my virtual nurses help with that too. So like I ended up having them do some research for me and provide me with a list of physicians in a certain zip code that do certain things and learn more about their practices and just do all of this background research for me and present it. And then I would help pick the specialists off of their lists. And the ones I have so far did not require they didn't require anything very, very intensive. Like I can see that it can get out of my hand being far away. I can see me asking them to just find a primary care doc where they are. But the ones I have such simple needs that can be addressed via telemedicine and by having them see few specialists where they are.
Love it. And it goes into my last question that I want to ask in closing. When you talk about developing your practice and changing your practice and bringing yourself to your patients as an individual, I want to ask, how would you advise the audience to think about being a more inclusive physician at their practice as they're, practicing in DPC or opening their DPC soon?
Yeah, so the answer to that question, I want to say in its core, when people want to feel like you would be inclusive towards them, they're like all of these things, we get lost in the messaging a little bit. Some people get lost in the gestures. It's like, oh, you need to have this workflow, use this language, or use these signs, or use these colors. But what people really want to know when they come to your space is that they're not going to be persecuted and they're not going to face discrimination because they're under your care. That's what people really want to know, which I know seems like such a basic thing, but they just want to know that when I come and seek care from you, you're not going to treat me differently because I'm a woman, or you're not going to treat me differently because I'm LGBT, or because I'm an immigrant, or because I'm a person of color, or because I'm whatever it is. And these thoughts come from prior mistreatment. So it's trauma-based, really. So when you come in, I would say, just be you, yourself, be comfortable in who you are, and just lead with love and listen and be open to feedback and just find your own way of letting people know that they're safe in your space.
Absolutely love that. Thank you so much, Dr. Nas, and good luck with everything that you're doing. And I hope to see you in person at SF Pride this year.
Me too. I'm so excited for it. Thank you for having me again.
Next week, look forward to hearing from Dr. Ryan Newhoffel of New Care in Lawrence, Kansas. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.